Good morning, viewer. Behind the here, here's a breaking news. One study published in Nature Immunology provides new information about a lymph node-like structure called territory lymphoid structures. These structures, which are highly organized collections of immune B and T cells, are found in some patients treated with immune checkpoint inhibitors. That's called the substances that reactivate the body's natural anti-cancer immunity and are associated with a greater treatment response too. However, researchers are still trying to fully understand what these structures contribute to immune responses to cancer, how they change over time, and what finding them in tumors means for patients. The study identifies a previously unknown form of these structures. Patients who have more of these structures are less likely to have a recurrence of their cancer after surgery, the investigator found. We identified the life cycle of territory lymphoid structures in patients with liver cancer, and the takeaway is that these structures may be very important in the generation of anti-tumor immunity and may increase the likelihood of occurring the cancer, says Mark Arkwan, MD, an associate professor of oncology at the Johns Hopkins Kimmel Cancer Center. Yarchown and his colleagues previously conducted the first clinical trials of immunotherapy before surgery for hepatocellular carcinoma. Only some of the patients were cured with with this approach, and the investigators have been trying to understand why. One of the things that struck us when we looked at these tumors was that patients who were responding in also to immunotherapy and territory lymphoid structures, he says, like lymph nodes, the structures have infection fighting immune B cells in the middle and tumor killing immune T cells on the outside. We wanted to learn what these structures are doing. They found that tumors with more territory lymphoid structures after immunotherapy shrunk more and were less likely to reoccur after surgical removal. Tumors without this structure, by contrast, did not shrink and were more likely to come back after surgery. For the same, territory lymphoid structures that grew in the center of tumors rather than around the edges were particularly beneficial. When the investigators looked at biopsies taken before and after immunotherapy, they found that patients who developed these structures had what looked like precursors of territory lymphoid structure prior to beginning therapy. When the study's lead author Daniel Su, MD, then a medical oncology fellow at Johns Hopkins, examined sites where the patient's tumor had been eliminated, he discovered a transformation in the territory lymphoid structure remaining at the site. In tumors where immunotherapy had the greatest effect, we found another form of territory lymphoid structure that has not been seen before. In this form, there was dispersion of B cells and apparent retention of so-called T cells zone, where T cells are primed to identify antigens, says Su, now at the University of Maryland School of Medicine. These same patients tend to have the greatest benefit from immunotherapy given in this way, while a lot more work needs to be done. Our hypothesis is that this form is a late stage of territory lymphoid structure that may contribute to long-term benefit we are seeing in this patient. Bravo sir, bow down. Behind this exclusive report.